Of course, Glenda, it's a pleasure. Well, this semester we've had a semester scaled back from normal. About 70 to 80% of our classes started the semester online, and we're probably drifting up towards 90% online. Our dorms are about two-thirds occupancy, and it's been a mixed experience. The good news is our research labs are up and running at about 60% their normal capacity, doing great work, including work on COVID. Our health system is back up into full operations, taking care of COVID patients, but also all other kinds of disease. Our classrooms, we don't have evidence of transmission of COVID in the classrooms, but we've had too many cases transmitted amongst undergrads in the dorms and amongst undergrads in social circumstances around the city of Ann Arbor. Yeah, we're enormously proud. We have an outstanding school of public health, and the epidemiologists from that school have become the principal advisors for Governor Whitmer's administration, helping them understand the spread of the pandemic, divide the state up into different regions, track what's going on in different parts of the state, establish metrics to measure the disease, and advise on mechanisms of control. So we're quite proud of them stepping up to serve the public. Well, it's had a significant impact. Our dorms are running at a lower occupancy than normal. Our athletic department, we're not having spectators at our sporting events. That is a hit. The cost of COVID-19 testing and the other interventions we've had to do are all expensive. And we've also invested more money in financial aid because we didn't want the short term economic impact of COVID in Michigan on our students and their families to force kids to drop out of school. So, fortunately, the semester in that way has gone well. The students are staying in school, they're going to complete their classes. The last day of in person instruction is next Friday. After that, there's a week off for Thanksgiving, and then the rest of the semester will be fully online. We'll give exams online, so the students will have made it through, a really challenging semester, but done well. Actually, our enrollment this year at the undergraduate level was exactly on target, so it did not adversely affect undergraduate enrollment. Some of our graduate programs are down, particularly ones that have lots of international students. You can imagine both the difficulty of international travel and then the mixed messages that our students, international students, may be getting from the government about how difficult it is to get a visa and the challenges of being a non citizen in the United States. Yeah, of course. So many things we're quite proud of. I guess most of all, we're a site of testing two of the vaccines that are in development, not the Pfizer vaccine, but two other good vaccine candidates. We're also testing a new treatment for COVID-19 that's gotten a lot of attention lately, an antibody from Lilly that can be injected early in the course of a disease to prevent a person from requiring hospitalization and more intensive care. And then our research labs are screening for new drugs that might diminish the severity or prevent the illness. And then also trying to understand the basic biology of how something as simple as a virus can bring the world's citizenry to its knees. Yeah, there actually is cause for optimism, and your station covered, and many others did. Very encouraging reports about a COVID-19 vaccine from Pfizer that's actually going to be manufactured in Western Michigan. So that's something of pride for our state. And the initial data was the vaccine was very effective. Now, it's not right around the corner. It'll certainly be the new year and then beyond where we administer this vaccine. But the fact that there's going to be a preventive treatment available tells us that we've got to do everything possible right now to prevent unnecessary loss of life and debility from the virus. If we can just hang on a matter of months or perhaps into the summer or fall of next year, keep the spread of the disease in control, a vaccine will come and will prevent the illness and allow us to start getting back to normal. So you can sort of start seeing the horizon now, and I find that optimistic. Yeah, I think there was a lot of anxiety on campus this summer. And, there's really not a lot of good news. Look at the number of cases in Michigan and around the nation are exploding. Health systems are filling up, intensive care units are filling up. The adverse news about the pandemic is pretty relentless. That said, the majority of our students are wearing masks, they're staying in low density, they're doing all the things we ask them to do, and the majority of them are staying healthy. Our faculty and staff are very concerned. Most of our staff are working remotely ever since March. The only people that come to campus are those whose work requires it. Our faculty are the vast majority of them are teaching remotely. So we've put our employees and our students in conditions where they really can keep themselves safe. But it's not a normal semester. There is a lot of fear and anxiety. And I think there's a phenomena that we've started calling, and others have, COVID fatigue. Just month after month of wearing a mask, staying in small groups, not giving your friend a hug on the diag. It's counter instinctual for our students. It's a real pleasure. Stay healthy, Glenda. Thank you very much.